everybody, welcome to our November Equality, Diversity and Inclusion Special Interest Group meeting. I'm Jade Maloney, Operations Manager here at the Institute of Health and Social Care Management, and we're thrilled to be joined by Angela Cornwall today, our authentic speaker with lived experience, and she's got lots of key takeaways for you all today. There'll be an opportunity to ask Angela some questions at the end, but to start with, she's going to talk to us a little bit about her background. She cares for a young person who has severe autism and learning disabilities, who requires regular checkups. So Angela's going to talk to us today about Speedy Boarding, which helps to make care accessible and prevent non-attendance, and helps with those with learning disabilities, neurodiversity and challenging behaviour. Angela is going to tell us how you can help work in collaboration with mental health and prevent non-attendance when it comes to these services and caring for young people. Angela, without further ado, I'm going to hand straight over to you, lovely. Thank you very much.
Oh, hi everybody, how are you all doing? My name's Angela Cornwall. I've been a carer, unpaid carer for 38 years now, for two young adults now. They're now young adults. And in my caring role, I literally, my daughter had a rare blood condition and my son is lately diagnosed with autism at the age of 21. Obviously autism, Asperger's, ADHD. So things can be quite challenging when attending appointments. But also in my time of being a carer and being an unpaid carer, I also studied to be health and social care. So there was a batch of time where I knew that, you know, my caring role would finish and obviously, you know, this is what I wanted to do later on. So I then had a period of about 4 years of where I was caring for nobody because everyone was old enough to kind of manage their own care, and obviously working with them to sort of like, you know, sort of help themselves and manage their own care and take the lead themselves. I had a period of about 4 years where I could actually go back to work. I went back to work in health and social care, and it was with young people with severe learning disabilities, autism, challenging, very, very challenging behaviour. And what I noticed was it was in residential. So these children, I looked after a young boy who had severe learning disabilities and autism and very, very challenging behaviour. So for him, a hospital appointment was almost, you know, impossible because it was 2-to-1 staff, and you know the environment. Would just the thought, the anxiety of going to hospital was, you know, just for checkups was almost, it was impossible. When I realised that this young person never had an appointment, he was 13, so he'd not been to the hospital for nearly 6 years, and I thought, wow, you know, that's just not right, is it? So I thought, right, okay, I went home and kind of rattled my brains and sat down, and you know, because we were 2-to-1, we kind of all sat together, a couple of us, to kind of work on on a strategy to, you know, to overcome this challenge. And so what I then decided to do was look at all, you know, the negatives to why it was almost impossible to achieve this appointment. And what it was first of all was anxiety. That's what triggered a lot of the behaviour. So I thought if we was to manage the anxiety from the point of beginning, because this young person was non-verbal, so obviously the anxiety would come with being non-verbal. So we used the cards that you can actually, like, how are you feeling today? This is what we're doing. And it was communication cards. And we use that to explain the process 3 days prior to the attendance of hospital. So we managed to kind of get him in a good place to start attending his appointments, and he agreed and he was okay with that. We asked him through the cards, communication cards, you know, and we kept communicating with him via that to kind of take away that anxiety. But our biggest challenge was actually when we got to the hospital. So what I recognised was that we had a young person with severe learning disabilities and challenging behaviour, which obviously with the autism and the overload of sensory overload, and there was just so much to it, that when we were told to go and sit in a normal waiting room with patients, that's just not accessible. So I spoke to the team there, because I'd had a lot of time at Alderhay, and I was quite familiar with Alderhay anyway. And I said, look, you know, this young person has, you know, sensory needs. We need to we really need to be doing better than this. We're not asking to be, you know, we're not asking for privilege. We're not asking to jump the appointment system, but what we're asking is a better system. So then I worked with the learning disability nurse at Alderhay and said, look, you know, we have a young person, we're finding it very difficult to access appointments, and this is what I think will work. And I said, right, okay, so when we come into the hospital, we need a sensory room. We need our own room, because this young person cannot sit, due to his disabilities, cannot sit in the waiting room with other people. So we need just, you know, a quiet, safe space. We need sensory stuff in there to manage the sensory overload, because that's what we were trying to prevent. Because if he had a sensory overload, then you would get a behaviour, then we'd have to very quickly exit, because obviously it's 2 to 1. So we were given a sensory room. We were given, you know, stuff on the ceiling to manage the sensory needs. So what we done was that we put a sensory plan in place for attending of this appointment. So we didn't just meet the medical needs or the clinical needs, we were meeting the sensory needs for this young person. And this is what this young person needed to attend their appointment safely, effectively. And we didn't need, you know, we asked for short, we didn't want to wait for 2 hours. This young person could not and would not wait for 2 hours because of their needs. So we needed that to be taken into consideration. So we almost had like a plan of action of what was requested for this young person to attend this appointment. They were all in agreement, because obviously they agreed that he should be able to see, that he should be able to have his appointment effectively like everybody else. So everything was put in place. So we had the sensory needs put in place, we had the quick timing put in place, and our appointment, and this is why it was called Speedy Boarding, was because it was fast, it was quick, it was efficient, and it was effective, and it worked. You know, this young person then accessed, and probably still does now, all of their hospital appointments, because it then became part of, you know, his journey. So, you know, if we had to have a heart scan, so, you know, by communicating and obviously taking the anxiety away from what was happening, we were explaining at all times. We engaged the young person in his care. So, you know, wow, look at the heartbeat, and, you know, look at this, you know, because we could do that. And by working in collaboration with him, even though he was nonverbal and he had, you know, learning disabilities, he still understood, and we respected that, you know. And by working with him, you know, rather than just giving him a system, this is what you do, you sit here for an hour and a half because we say you have to do that, you have to wait like everybody else. Well, some people can't wait like everybody else. And by putting that in place and making sure that then, you know, his needs were met, you know, it took away all of the anxieties, it took away. So now the appointment systems are now effective and they're working. And that is why that's why I called it Speedy Boarding, because we wasn't asking for no privileges. We were just asking the NHS to identify the need of this young person to access his healthcare, because, you know, in inclusion and everything like that, everybody should be included. Nobody should not be able to access their healthcare because they have a disability and because your systems don't work for them. So it was about working in collaboration. It was about understanding and working as a team, and respecting the fact that, you know, we need to work together for this. And it happened, and it worked, and it's still working now. And I'm very proud of Speedy Boarding, and I hope it goes as far as it needs to go, you know. And I don't think it's just for mental health. I think it's I think it can be used for many other you know, other appointment systems. And yeah, so that's really roughly, you know, how Speedy Boarding came about.
Thank you, Angela. That was really interesting to hear the backstory of where Speedy Boarding was sort of born. Who were those key professionals that you first spoke to, and why were they so instrumental in bringing this initiative to life?
Because when you have an appointment, when you have a young person and they need medical attention and they do not get that medical attention because of a system that doesn't work for them. So when I spoke to the LD nurses at Alder Hey, they were in agreement of what I was saying, because I said, just because they have severe learning disabilities and communication problems, why are they not attending why have we got nothing in place so they can attend their appointments? Because they have a need, they have a medical need as well. So why, why can this not be met? We're in the 21st century, why is it not being met? So they agreed. And I worked with the LD, so I would go to because most departments have learning disability nurses, or any member, and also my biggest thing was when you at the reception point, we really need staff that are trained and understand autism, learning disabilities, mental health, because if we don't, then that's where it can go wrong. So, we've done a really big push for most staff to be trained in LD and learning disabilities and understanding sensory needs and autism and noise and smell, and what a waiting room to a severe, to someone who has severe autism, what a waiting room is to them. You really need to understand that. It's really not the same. It's not the same. So working with, the first point of call would be your learning disability nurses. And if you don't have them, they're really worth training and employing, because you really need somebody that can take that lead. So prior to the appointments, I would phone and say, right, we are coming in, like we'd get the appointment, right, we are due in on the 22nd of November. Our appointment's at 10 o'clock. Can you be waiting? So basically, as soon as we hit that waiting room, we would literally, she'll be waiting for us. So it was a pathway, she'll be waiting. So she would make sure the sensory room was made up. She'd make sure the doctors were aware that he was here. She would make sure that everything was in place so we can just go 1, 2, 3, and let's go out the door. Because a hospital appointment caused the anxiety. Anxiety then caused the violent behaviour. So let's get it right. We got no time to not get it right. So yeah, so your learning disability nurses are really, really important, especially if it's through like accident and emergency or, appointment systems. They really should be there, because not everybody's the same. Some people need different support than others, and we really need to make sure it's in place to make sure it's effective, because when it's not effective, then it doesn't just cost the person, but it also costs the NHS. So, it's a no-brainer. If you get it right the first time, then you're okay. You're really okay. You'll find it sailing.
So are you aware of other trusts that are rolling out Speedy Boarding? And if so, how are they communicating that initiative so that service users are aware of that pathway for those young people that have those sensory needs and specific challenging behaviours, so they're aware before they turn up at the hospital for their appointment of what to expect? Because sometimes, like yourself, it just takes somebody having a conversation with that first person that you meet to say, these are my needs. But how can you prepare those service users before they arrive at the hospital?
So for example, for us, the young person was non-verbal. So we would prepare, we had cards, verbal cards that you'd use. So we'd have a 2-day, the main trigger was anxiety. Yeah, that's what the biggest trigger was. So if we worked with that young person for 2 days prior to just take away the anxiety, just so that they know what's going on, and that we can actually, communicate, this is what's going to happen, this is the time it's going to happen, and this is why you need it. And we explain that, you know, via the verbal cards, and prepare them for the appointment. So making sure that the anxiety is, you know, is quite minimal before you kind of, you know, attend any appointment, you know.
I can hear we've got our member Ian with us today. Ian, good to see and hear you. Thank you, Angela. At this point in the call, I'd like to invite our audience members, if they've got any questions for Angela or any comments on what their organisation is doing similar to Speedy Boarding. I'm sure there are other initiatives out there. This is your opportunity to ask Angela any questions or share your experience and thoughts.
Hi Angela, I'm Donna. Accidentally moved the camera. Have you seen an increase or a benefit since the Oliver McGowan trainings came in? Because we had to do the Oliver McGowan training, and it's now mandatory across the NHS. So everybody should be doing the training to eliminate that and get speedy boarding on case. Have you seen that kind of improving in ultra high in the hospitals that you're dealing with?
Without a doubt, without a doubt. Yeah, without a doubt. Yeah, I have 2 children with disabilities, and I use both. I designed 2 passports for both my children. I use a passport system for them because their needs are different. So if you're a consultant, then with my daughter, she has a passport of care. So this is who you communicate with. This is what, because it just delays. Yeah, I've definitely seen it it's just eliminates unattended appointments. It eliminates, you know, the quality for the person that needs to attend the appointment. You know, it's effective. It's effective for the cost of the NHS. It works. Yeah, I've seen it work. Yeah. Yeah, most definitely. It's what I use. I've been using for like nearly 20 years with my own children as well.
Yeah,
now adults.
But have you seen an increase in people in awareness and things since the Oliver McGowan training started this year?
No, I've not seen awareness. I'm not even aware of who did you say? Sorry.
There's Oliver McGowan. It's a national training that we have to do for awareness of LD. And it brings in speedy boarding and the communication cards and things like that as well. So I'm hoping that as that kind of gets rolled out, you'll actually see that more as a everyday benefit. Yeah,
that'd be really nice.
Donna, do you want to just give a little bit of an overview of what Oliver McGowan training is? I have heard of it because we had Oliver's mum a couple of years ago come and do a podcast for the Institute, and I'll see if I can find that in our archive and make it available to you, because she talks about Oliver's story and why that training was imperative to be set up. So Donna, if you just want to give us a little overview while I find that archive link, that'd be great.
Yeah, it's just really useful. We've had to do it in Wiltshire, and it kind of takes a day and a half. So the second day is face-to-face, where you've got a facilitator from the Oliver McGowan Trust, and then you've also got people with lived experiences come and facilitate it. And it covers you the onboarding, the need for people to be treated as individuals, but it's multidisciplinary training. So within the room, it wasn't just health professionals. We had residential home workers, we had day case workers, we had social workers, we had healthcare providers, and you could just get that cross working going across it and things like that as well. So it kind of captures what you've been doing, Angela, for the last 20 years, but it's making it formal, and it's now mandatory across the NHS and healthcare.
Oh, wow.
So
brilliant.
Everybody has to do it. So I just wondered whether you'd actually seen the uptake and the increase of how it's getting across.
No, I'm going to have a look. I will have a look later on today and see. Yeah, I'll have a look.
Yeah. I think she's got websites and stuff like that as well. So that could be something that you can pick in to kind of share with anybody else and other people that are on the call and stuff. That is a really good training system that is now up and running.
Yeah, I'll look at that. Thank you.
Thank you, Donna. Thank you, Angela. I've just posted a link in the chat box to that podcast with Paula McGowan, which is Oliver's mum, and also a link to the website for anybody that wants to access those resources. For those unable to join the call today, I'll make sure that those are shared with the recording link. Did anybody else have a question for Angela, or experience that they've had or seen that they'd like to contribute to today's discussion? You can raise your virtual hand or physical hand just to help me find you and bring you on screen. Angela's using a mobile device today, so it just helps her see you and hear you at the same time. I can't see any questions at the moment. So just drawing on then from Donna's thoughts and feedback about the Oliver McGowan campaign and the training there, what should be a universal standard for support when it comes to young people and their specific needs when they are accessing support services like at a hospital or through social care? I'd really like to have this discussion because as a group, we are creating a resource guide that has 5 strands, one of which is around neurodiversity and hidden disabilities, around LGBTQIA+, around BAME and minority groups. So any discussions and feedback and resource links that you have available to yourselves through your organisation or personal experience be really beneficial to share with the wider group and IHSCM members. So this is your opportunity today to get involved live, but if you'd rather contact me via email, you are more than welcome to do so. So I'll pop my email in the chat for those of you that may not have it. But while we've got Angela, if you have any questions for her, it'd be fab to hear from them now. Ian, do you have a question? Your dog's under control.
Not very well, but we'll see how they do. Shush. Right, stop it. Oh.
Would it be easier for you to type your question, Ian, and I'll read it out for Angela? That might be easier.
What I'm saying is there any age limit to access to some of these services and training?
Okay, fabulous. Thanks, Ian. So Ian was saying there, is there any age limit to accessing the speedy boarding pathway? Do you know of that, Angela?
No age limit. Sorry, can you see me?
Yes, we can see you, Angela. Thank you. And Ian
no
just put his thumbs up.
Yeah, no age limit at all. If it works for that person, then it, use it. That's there's no age limit at all.
Brilliant. I think we may have exhausted our questions today then. If that's the case, I can't see anybody else that has their virtual hand up or physical hand up. Is there anything that you would like to talk about, Angela, that you feel is not being addressed? We already talked about the success of speedy boarding, but are there still issues that you're facing that is yet to be addressed?
Yeah, just really just like the mental health, the pathway, completely now, just how it changes from sort of like sort of areas, from districts, and like, if my biggest worry at the moment is that my son had a crisis with his mental health, and basically what happened was when he communicated with his doctor, because how he was feeling, everything was put into place for the support there and then, but nothing continued and nothing followed up. So I'm trained health and social care, but I'm also a parent mum. So luckily I knew what to do. I'm thinking about the other parents who have a young adult with mental health, and yeah, it's fine, you know, drugs, alcohol, suicide, you know, that's fine. The minute you say that to your doctor, everything is put in place there and then, you know, and you have about a week of everybody communicating. And then all of a sudden, it stops. That continuity in healthcare is so important. You know, follow up, you know, keep in contact, wait until maybe your patient tells you that they are actually okay now, you know, it's fine. And I couldn't understand, to me, it felt like a bomb had dropped, you know, and then all of a sudden, all of the support was there for 7 days or less, and then that's it, all gone. No follow-ups, no, nothing. Luckily, we have a really good GP. And last week, the GP called my son and said, "How are you today? How are you doing?" Because they put him on antidepressants for a little period of time while he's waiting to be referred. He has an autism, he's had an autism diagnosis. He's had an ADHD diagnosis. But now he has, because we've moved from Liverpool to Cornwall, we now have to wait 2.5 years for another diagnosis that we already have before they would treat him. And in that time, my son decided to take drugs and alcohol to self-medicate. So when he come to me and asked me for help, and obviously we helped him, and the GP was fantastic. There was a period of about 4 or 5 days where all the support was thrown into place. But then all of a sudden, there's no continuity. We're still waiting for an ADHD, to meet the ADHD team in Cornwall, but he has a diagnosis. All we're asking for is the assessment to see what medication can support him with his ADHD. Because when we were given the diagnosis, that was it. No follow-up, no nothing. There's your diagnosis, go away and live your life. You know, my son, you know, had a nervous breakdown because of his mental health. And at that point in time, his ADHD was being managed because he was only young. But when he was diagnosed at 21 at university, that is when it just, there we are, there's your diagnosis, see you later. There was no continuity, there was no follow-up. And because we've changed boroughs now, we're back to square one, you know, where there's the fact that my son nearly took his own life. He was self-medicating with drugs and alcohol, which thank God now he's fine, because we've obviously supported him to stay well. He's had his counselling, he's done everything else in place, but there's been no follow-up, there's been no continuity, and we're still waiting for the ADHD medication, you know. Luckily now he does cold water swimming, which when he feels the anxiety and the stress, that's what he helps, you know, because I'm a practitioner. So I've said to him, the cold water swimming's really good, the walking's really good. So, you know, these are the things that you have to change to help you support yourself with your own mental health. And these are the strategies that we've put in place. But that's it. He's been left, you know, he's been given this great big diagnosis at the age of 21 and that was it. See you later. Which I don't think is right. And this is why we have a crisis with our young people with self-medication for drugs and alcohol, because that's it, they're left.
Well, we have seen from discussions with our mental health special interest group, Angela, that, you know, waiting lists are growing and there aren't enough mental health providers or workforce large enough to cope with the demand for mental health provision. We've actually got a survey at the moment that I'll put a link in the chat for you to complete that's asking about what it's like in terms of mental health in your area. You mentioned there about the differences in boroughs. Now, hopefully this is where ICBs can come together and work collaboratively on mental health service provision. But I know from personal experience of a child that's in school, where my daughter attends school, and the mum is unable to get the child to attend school because of anxieties that's causing challenging behaviour. She hasn't got a diagnosis, but yet that child has traits associated with autistic spectrum disorder. But because she is on borderline with Knowsley and Halton, her GP is in Halton, but her counsellor is Knowsley. She's struggling to get the support for a diagnosis, and I know that that is crucial to gain support. Your son, you said, Angela, was diagnosed at 21 at university. What was it like for you before you had your son's diagnosis, supporting him? And when it came to the likes of health and education, did they understand his needs before he was formally assessed as having ADHD?
No, he was a naughty child that nobody really wanted to deal with. At one point, I actually did say to his teacher, have you maybe sat down and thought about the way that you communicate and deal with my son might be, maybe he needs to be taught a different way, because I always been involved in sort of like what I do for health and social care, one coat doesn't fit all. And that's when that kind of question mark came. I knew, because of his energy levels, his eating levels, there were certain behaviours and traits that he had from a very young boy. Even as a baby, he never slept. So I did suspect, but I wanted him to, I didn't want to sort of like, I just thought, okay, is this just a young boy growing up? Let's wait until he's about a little bit older. And it wasn't until he was sort of like hit university that's when. But we had a lot of challenges. He was the naughty child, he was lucky he didn't get in trouble with the police and stuff like that when he was a teenager, because he was LGBT as well. I think he was trying to sort of like identify with his sexuality and stuff. So he kind of reclused off from the world, to be quite honest with you, and kind of just had, sort of spent a lot of time at home. He's a fantastic dancer. So he managed a lot of his anxieties with movement dance. He'd done his degree in musical theatre. And if you look at the LMA choir, Joel is, he's the part of that. He went to X Factor, and he'd done all of that. And luckily, I think because I knew how to manage him, I kind of, we used dances. So we went to sort of like rugby, to sort of like manage his behaviours with rugby, gymnastics, swimming, walking, so we've done a lot of that stuff. So it kind of, hospital doctors, he was not too bad with. He actually was okay with that. We didn't really have much problems with that. But with like school education, then that was a very challenge. It wasn't him. It was just, unfortunately, it was the teachers. And they were in that time, he's 25 now, so I suppose in that time they really wasn't sort of like as educated about it as they are now, or socially accepting to the fact of autism and stuff. You're always classed as a naughty child, too much energy, too much to say, too much to do, too much. So that kind of, it did affect him in his sort of like his own personal, because obviously being told that, like, oh, you can't do this, you can't do that, it's not this, it's not that, where I didn't. I always encouraged him to, that's brilliant, that's good, let's do this. It really needs to change, doesn't it? Because, if you take a person with learning disability or autism, it doesn't, just because they have a disability, it doesn't mean they can't achieve it. They just got different ways of doing things, and the way that their brain functions is a lot different. And if you can identify and understand how they function and work, then you'll pull the best from them. It's just a little bit more time than the average, average time. It's just bit more harder work, isn't it? You know, he's a fantastic dancer. He went off to work with Ollie Murs, Robbie Williams, you know, X Factor, you know, yeah, he's got he's got some great skills. He was chosen for Team GB for running, fantastic rower. Yeah, so, you know, given the right, you know, the right people, the right environment, these kids they are so, you know, they can thrive so much. People underestimate, they have a disability, they can't do it. Don't say they can't do it, find a way that they can, you know? And that's, you know, it's just, it annoys me.
It's clear that your son's got several accomplishments there and accolades under his belt, and should be very proud.
Yeah.
You talked there around support when it comes to inclusion. That's the buzzword, particularly for this special interest group, is around inclusion. So if you could, now our CEO John Wilkes normally puts on his little fez and dons his genie jacket and would say, if you had one wish, what would you wish for that could happen now that is not already happening, that would be more inclusive to those who are neurodiverse and have learning disabilities, so that they can be more accepted in the workplace, to be more supported in the workplace? And when it comes to health and social care and your access to support, it's improved and it's the highest quality it can be, because that is what we're striving for as an output of this group, is to share best practice and scale it so that it becomes local, regional, and eventually global as well. So everybody is doing the same thing, working collaboratively so that everybody is included.
I would have one educated person in every workplace, in every educational system that understands neurodiversity. And as soon as that person, what age they are transferred into that system, whether it be educational, workplace, they respect and understand, more so understand, that neurodiversity just means that the brain functions differently. So I'd have one person that would be allocated to that person, so that they had, so where we go into a workplace, we have our normal work teams. There'd be another couple of like a team of people that the neurodiversity people get allocated with as a support, because they understand them, they know how to work with them. Because the issue is now is that people don't understand neurodiversity, they don't know how to work with these people, and they look at them different and they look at them odd. No, you know, that's not a failure in them, that's a failure in you. You know, so I would have a team of people, whether it be in education, hospital, doctors' appointments, where they can accept the neurodiverse people that are coming through the systems. And then what can happen is then it can support them to work and stay included in an environment, you know, like my son says, I don't have a problem, the world has a problem with me. You know, so it's about making people understand that. And if I had a pathway from start to finish, I think people would stay and work longer, they'd stay in education longer. I think the drugs and alcohol would not be as much of a big issue of self-medication. I think things need to be identified right from the beginning, and support needs to stay in place, and it needs to stay in place, and it needs to sustain. It needs to be there from start to finish, not keep dropping out drips and drabs. It needs to be right from start to finish. And I think if there was a system in place for that, for every department that is workplace education, I think that we won't have no issues. I think we'd actually benefit more from neurodiversity. I think we'll be bringing out skills in people, helping, supporting them to stay in long-term employment. You know, there's so much. You know, people used to say my son was stupid. You know, no, you know, he wasn't stupid. He just done things differently. And if he, you know, because he had that support from us as a family, he was lucky to be able to go further. But, you know, this is where it all falls. You know, there needs to be a system in place for them that supports them from start to finish, whatever they may do in their life, and prevent them from drugs and alcohol, or being being rejected from society because they are different. No, should be no rejection, inclusion and everything.
That's certainly achievable wish there, Angela. Now, it's not as effective, but I'm still going to go down Shazam. For those of you that have seen John don his fez and genie jacket, you'll understand the Shazam there. But yes, wish granted. That is certainly something that we can achieve, and this group will be working together collaboratively with our wider IHSCM membership, sharing best practice so that we can achieve that one day. I'd just like to thank you for your time today, Angela. It's been really insightful. Your story and your son's story has been really authentic. I'm sure lots of you here in the audience today and those watching on Catch Up will have some takeaways there. And what I'd like to do is close the recording now, but for the couple of minutes that we've got left, I'd just like to use the opportunity with the group to discuss where this group could go in the next 6 months. So looking forward to 2024. Angela, feel free to stay on the call and listen in. Your wisdom is very much welcomed here. But yeah, thank you so much for your time today, Angela. It's been really insightful, and thank you for sharing your and your son's story. So on behalf of the IHSCM, thank you so much. I'm going to stop the recording here now. Thank you, everybody.